Micah Brown's body is covered in tattoos that help tell the story of her life.
And he wrote and published a poem in which he compared me to a paper crane.
From favorite moments to heartbreaking loss, like her brother's handwriting, all the more precious after he died by suicide.
That says, "You are not alone. If you need anything, I'm here."
It is a powerful message Dr. John Constantino with Children's Healthcare of Atlanta wants to give to every youth that comes through its doors, especially those who have attempted or had thoughts of suicide.
In great medical care, the model should be to own the condition until it's resolved or until there's a pathway of care.
But until now, that wasn't happening. It's why Constantino says 20% of youth that came into its emergency rooms with a mental health crisis were back within a month.
One of the great enemies of the way the mental health system is set up at present is that care is extraordinarily fragmented.
That's why Children's has a new vision, the Zalick Center, a behavior and mental health care clinic to pull together the missing pieces. It will work with children on Medicaid, provide DBT and CAMS care, two treatment methods hard to find in the metro. It will take ownership of cases even if the person goes to a residential treatment facility first. And instead of waiting weeks, care will start immediately. Dr. David Jobs developed one of the therapies Children's plans to use.
And we treat the problems that the patient says makes them consider suicide, which we call drivers. And those are mostly relational issues or issues around vocation or issues of how people feel about themselves, relatively identifiable and treatable problems.
As simple as that sounds, Brown, who also attempted suicide several times in her youth, says in all her years of therapy, she never received that kind of care until going through drug addiction recovery.
I never felt as though therapists were actually trying to get to a place of understanding a root cause. I don't think I ever got that far with a therapist.
But right now, that kind of care isn't easy to find. Search the online directory for therapists in Georgia trained in CAMS care, and only 3 names pop up. Only one takes Medicaid and will work with teens. If this works, why aren't more people doing it?
Because it's hard, and because we have an established way of thinking for decades, really, that a person who's suicidal should just go to the hospital.
But the goal of Children's program is to keep people out of the hospital.
If that had existed for me, oh man, I would have liked that, because I hated treatment centers. I hated being in mental hospitals. I hated being in places where I had to wear grippy socks.
Now a hospital chaplain and advocate with the American Foundation for Suicide Prevention, Brown knows getting the right help early can change the canvas of one's life.
I had such severe depression as an adolescent, and I didn't have the words for it. I didn't have the resources to be open and speak about my experiences, and I felt invalidated.
Brown still may not have all the words, but her brother did leave her with a few that are pretty important.
This one up here says, "I am proud of you."